today we are going to examine the JVB, jugular venous pressure. زين. This patient is chronic bronchitic. He had core pulmonale, he had leg edema, and he is a smoker, heavy smoker, and he got elevated JVB. And this is the way to examine the JVB. We turn the patient head to the left side of the patient, and then we move the chin of the patient upward and downward in order to relax the sternomastoid. This is the sternal head of sternomastoid, and this is the clavicular head. And we just tied the skin on the other side. This is the way to examine the JVB. We look for the direction of the JVB in the outer border of the sternal head of sternomastoid, or even in the inner side of sternomastoid. This is the way to the angle of the jaw. And we look for pulsation. Yeah, there is pulsation here. Actually here, yes, true. Pulsation. Actually, we see two pulsation, one and two. The third pulsation is difficult to see. It's very difficult to see. Therefore, pulsation coming from the clavicle upward to the mandible. And this is the site of pulsation in this gentleman. This is the pulsation, upper border of pulsation. How we measure this JVP? First of all, we should be sure that this is pulsation is venous, not arterial. We put our hand on that pulsation. If my finger is lifted up, this is arterial pulsation, and it is usually single, not two. If not lifted up, therefore it is what? It is a venous pulsation. Secondly, when we press the upper part of the clavicle just like this, the pulsation disappeared, while the arterial pulsation it not disappeared. It will stay, because arterial is not compressible unless you killing the patient. Therefore, this is pulsation here. We need two ruler. Master تينطونا. طينا مصدر من ناحية من جوي من جر اللي فوقي. لا. طينا قلم. This is the way. We put this as a ruler, and then we measure at the angle of Lewis, and it appeared to be 6 centimeters. It is 6 centimeters above the angle of Lewis. Therefore, the JVP in this patient is 6 centimeters water on above the angle of Lewis. The question arises: what are the causes of elevated JVB? Normally, the JVB should not be more than 4 centimeters above the clavicle. That's the clavicle. Normally should not be more than 4 centimeters above the clavicle. This is the normal JVB. This is the site of normal JVB. Because if we put that ruler on the angle of Lewis, it comes to this area, to this 4 centimeters. Okay? JVB normally not more than 4 centimeters above the clavicle. If anything above more than 4 centimeters, you should measure it by two rulers. This way. Okay? And you see how many centimeter above the angle of Lewis. This is JVB. What are the causes of JVB? What are the causes of JVB? Elevated JVB. All the causes, we should say cardiac causes and non-cardiac causes. Cardiac causes, all those in the right side. We haven't got anything in the left side of the heart causing elevated JVB. Mitral incompetence, mitral stenosis, aortic incompetence, aortic stenosis. It never causes elevated JVB unless it causes pulmonary hypertension. Okay? Therefore, heart causes of JVB elevated is what? Is right side failure, pulmonary stenosis, pulmonary hypertension, tricuspid valve disease, restrictive, constrictive pericarditis, all these causing burden on the right side of the heart, causing elevated JVB. This is the cardiac causes. While the non-cardiac causes of elevated JVB are hyperdynamic circulation, exercise, pregnancy, thyrotoxicosis, fever, and given a lot of fluid, all causes elevated JVB. Okay, we see actually two waves, A and V. Okay, and these not more than these. It's very rarely to see the C. JVB. If the JVB is not visible, what we should do? We press what? The liver area. This is the liver area. We press it here, and we look for the JVB to rise. We press it for 14 seconds, 1, 2, 3 till 14, and if the JVB is raised, elevated, and we press the liver, normally the JVB it rises and it will be down while we are pressing. While we are pressing, it elevated and then come down while their hand on the liver area. While if the JVB is elevated on pressing of the liver and it doesn't come down until we remove our hand from the liver, this is called hepatojugular reflex. The JVB elevated, but it doesn't go down until you remove your hand from the liver, pressing the liver. This is called what? Hepatojugular reflex. And hepatojugular reflex, you see it in right ventricular failure. This is regarding the JVB. Any questions?